Today, we will discuss how to get rid of knee pain, make your bones stronger, and reduce inflammation. We will especially focus on maintaining cartilage health and the natural reduction of pain, swelling, and stiffness. Cartilage is a robust and highly elastic connective tissue found in the joints between bones, enabling the normal movement of one bone over another. You may begin to damage the cartilage of the knee due to injuries, aging, osteoarthritis, rheumatoid arthritis, poor nutrition, and repetitive strain due to excessive weight. If this important tissue in the knee begins to deteriorate, inflammation starts to form in the knee. This inflammation manifests as pain, swelling, or stiffness in the knees. These symptoms often last for many years. If one ignores these symptoms, it can lead to the disease reaching critical stages, such as increased severity of arthritis, increased risk of bone fractures, and reduced range of motion and flexibility in the knees. Chondrogenesis is the process by which cartilage is formed from condensed mesenchymal cells containing collagen types. Cell division within cartilage is a very slow process, and cartilage growth involves immature cartilage developing into a more mature state. Chondrocytes are responsible for producing large amounts of extracellular matrix collagen and ground substance rich in proteoglycans and elastin fibers. Cartilage is classified into hyaline, elastic, and fibrous. Each type has different amounts of elastin and collagen. Articular cartilage is a specific type of hyaline cartilage, particularly smooth, white tissue covering the ends of bones where they meet to form joints. Healthy articular cartilage allows the joints to move and slide over each other with very little friction, but it is subject to damage and injury, as well as normal wear and tear. The first compound for knee health is glucosamine, which is naturally found in the cartilage of your joints. It is made of chains of sugar and protein linked together. Glucosamine acts as one of the body's natural shock absorbers and joint lubricants, allowing you to move while minimizing joint, bone, and muscle pain. It plays an important role in building your joints, tendons, and ligaments. It helps create the fluid that surrounds the joints to ensure lubrication, known as synovial fluid. The synovial membrane is located around the joint, and its task is to nourish and lubricate it. Glucosamine has an extraordinary effect on improving the function of the synovial membrane. It slows joint degeneration with prolonged use and offers other benefits that prescription pain relievers cannot, such as reducing chronic inflammation and improving digestive health. Glucosamine can stimulate the production of mucin, which helps protect the gut lining and facilitate the passage of food through the digestive system, aiding in easing constipation. Glucosamine is found in shellfish shells, animal bones, and fungi. Supplemental forms of this compound are often made from these sources. The recommended daily intake of glucosamine is 1,500 milligrams per day. Chicken feet are a good source of glucosamine. They contain about 30% cartilage, and cartilage is roughly 5% glucosamine. While bone broth is often touted for its glucosamine content, the actual amount is very low. 200 grams of bone broth contains approximately 200 to 400 milligrams, while 200 grams of chicken feet contain approximately 1,200 to 1,600 milligrams. The next essential nutrient is vitamin D. Vitamins are substances that we cannot produce in the body, except for vitamin D. That's why we can consider it a hormone. Our bodies can produce vitamin D when chemicals in our skin are exposed to sunlight. This vitamin D is either stored in our fat deposits or transported through the bloodstream to the liver, where it is converted into its active form. Vitamin D is crucial for the development and maintenance of healthy bones and teeth, as it enables the proper absorption of calcium by increasing the production of special proteins in your intestines that are responsible for actively transporting calcium across the intestinal lining and into your bloodstream. Vitamin D also helps prevent and treat cartilage deterioration. Research indicates that vitamin D levels are linked to the development and progression of osteoarthritis. Additionally, recent studies have found that vitamin D can help prevent cancer. Vitamin D helps regulate how cells grow, divide, and die. Think of it like a traffic cop directing how cells behave. Without sufficient vitamin D, cells may begin to grow and divide in an unregulated manner, potentially leading to the formation of tumors. The recommended daily dose for optimal bone health is 1,000 international units to 2,000 international units. Sources of vitamin D include sunlight, cod liver oil, salmon, liver, egg yolk, and mushrooms. The next vitamin recommended for knee health is vitamin C. Most people know that vitamin C is important for the immune system and fighting colds and infections, but it also plays a major role in the health of your connective tissue, as it is needed for collagen production. Vitamin C increases the production of collagen by stimulating fibroblast, the cells in the skin responsible for producing collagen and other connective tissues. By boosting collagen production, vitamin C not only increases bone mass and density, but also helps maintain skin elasticity and firmness, reducing the appearance of wrinkles and fine lines associated with aging. One of the main functions of vitamin C is the repair and maintenance of bones, teeth, and cartilage. People with problematic knee cartilage probably lack vitamin C. Vitamin C is a water-soluble vitamin found in many types of fruits and vegetables. It acts as an antioxidant to neutralize free radicals and reduce the risk of inflammation and disease. The recommended daily intake of vitamin C is 500 milligrams per day for optimal knee and bone health. Before going into the sources, it's crucial to understand that vitamin C degrades over time. Vitamin C is a natural antioxidant, meaning it readily donates electrons to neutralize free radicals. Whenever possible, choose brightly colored fruits and vegetables and avoid wilted or bruised items. Foods rich in vitamin C include kiwi, peppers, oranges, lemons, strawberries, papaya, pineapple, mangoes, and spinach. Vitamin K is another crucial nutrient for knee health. It comes in two forms: vitamin K1, which is found in kale, spinach, Swiss chard, collard greens, and cabbage. Sources of vitamin K2 include beef liver, which contains approximately 106 micrograms per 100 grams. Goose liver has the highest amount with 369 micrograms per 100 grams. Natto, a traditional Japanese dish made from fermented soybeans, has the highest concentration of vitamin K2 of any food, with 1,000 micrograms per 100 grams. Cheese, especially hard and aged varieties like Gouda, contains 75 micrograms per 100 grams, and Jarlsberg contains 74 micrograms per 100 grams. Eggs from pasture-raised chickens have good amounts of K2, with 16 micrograms per egg yolk, and butter from grass-fed cows contains 15 micrograms per 100 grams. Research shows that a higher intake of K2 improves bone strength and reduces the risk of fractures. Vitamin K is vital for activating a protein called MGP, a component found in muscle, bone, and cartilage. This protein plays a critical role in regulating calcium deposits throughout the body. When activated by vitamin K, it binds to calcium, preventing it from accumulating in unwanted areas like arteries and soft tissues. This helps calcium bind to our bones, which aids in building and maintaining bone health. Always use it with healthy fats, such as olive or avocado oil, because vitamin K is a fat-soluble vitamin. When you eat vitamin K alongside healthy fats, the fat acts as a carrier, allowing your intestines to absorb more vitamin K from your food. This ensures your body gets the full benefit of the vitamin. Vitamin K activates various other proteins that support synaptic plasticity, the ability of brain cells to adapt and change, which is important for learning and memory. Vitamin K has been shown to reduce amyloid plaques, a hallmark of Alzheimer's disease, by promoting their clearance. Some studies suggest vitamin K influences the elasticity of blood vessels and reduces arterial stiffness, which can help handle blood pressure fluctuations, maintain healthy blood flow, and reduce the risk of heart disease.